There's a growing realisation that mental health problems aren't just in our brain, that they can affect many different parts of our body, including our blood. So effectively, you've taken the blood from people with schizophrenia and people without schizophrenia, and you could see the differences in their blood.
Yeah, absolutely. So it actually turns out that cells from patients with schizophrenia utilize calcium in a slightly different way. The calcium is used to communicate within the cell, and the cells from patients with schizophrenia are communicating in a different way.
The Cambridge team is now using that difference to try out new medicines. If a drug fixes the problem in the blood, it could also help make the patient feel better. Until now, people with schizophrenia have used trial and error to find a drug that works for them. The whole process can take years, if it works at all. But by testing different drug treatments on something as readily available as their blood, this team hopes to speed up the process and find new medicines.
The main intention is really to identify drugs which are currently already exist and are already used in patients for other diseases like heart disease, like inflammation, etc. And to test whether these drugs can also help certain patients with schizophrenia.
It's extremely hard to take brain cells from living patients, but it's simple and safe to take and test their blood. And all you need to see what's going on inside the cells is some bright lights. The best way to analyse the blood is to put fluorescent dye on it and then shine a laser on it, and that shows you exactly what's going on inside. This technique could potentially work for a number of mental health problems.
We ourselves have looked at depression, we've looked at bipolar disorder and autism spectrum disorder. We found abnormalities in the blood in all of these disorders.
Around 1 in 5 of us will be mentally ill in our lives. There haven't been any major drug breakthroughs in decades. Testing new medicines on our blood should fast-track the process to find new treatments. Richard Westcott, BBC News, Cambridge.